Welcome, everyone. I hope you are all here and present. My name is Lalita Carballo. I think I know most of you. Probably have a few more people to come in who've registered for our Supporting Cancer Care Research Forum, but welcome. Today we've got Ruth Anderson, who is our second speaker in our monthly series of our Supporting Cancer Care Research. Ruth is going to talk with us today about her PhD work, thinking about cancer patients' experiences of moments of relational depth during psychological therapy. For those of you that don't know Ruth, Ruth has been working with us at UCLH in the hematology psychological care team for 6 years, and prior to that she worked in a mental health charity for several years. Is that right, Ruth?
Yeah, that's right.
Yeah, okay, so I think we probably should get going, but just some sort of basic ground rules. First of all, could you all, with the exception of Ruth, obviously, please go on to mute whilst Ruth is talking. And then in terms of questions, so we'll wait for Ruth to finish her talk. And then if you would just very kindly, if you've got some questions, put your questions into the chat box, and then I will pick those up as we go. If questions emerge whilst Ruth is talking, then please do put them into the chat box, and then I'll mop up those questions at the end. We may have some opportunity to ask Ruth some questions directly, but let's start off with the chat version and see how that goes. So if everyone could go on to mute, that's great. And the other thing just to say is we are recording these forum sessions. So if you want to see the recording, then please do, we'll actually send you the link on YouTube. That's probably the best thing to do. So without further ado, and I know that people are coming in, over to you, Ruth.
Thank you. Thanks, Lalita. Can you hear me okay?
Yes.
Lovely, lovely. Okay. So just to start, I wanted to set the scope of my presentation today. So I'm going to focus on 3 areas. I'm going to talk about why I chose this research area, the different themes I identified, and some of the possible implications I thought there might be for clinical practice. And I want to try and leave a good amount of time for questions at the end. And as Lalita says, if you can put those into the box. So just to start off, in terms of identifying my research question, I think it's important to say that it's an area of personal and professional significance for me. And before I started doing my doctorate in 2016, I did a postgraduate diploma in counselling and psychotherapy. And I also started a placement in the haematology, counselling and psychology team at UCLH. And during this placement, I became increasingly aware of the contrast that some patients experienced between their encounters with the medical team, where they sometimes felt reduced to a patient number, and their encounters with other members of the team, perhaps, and with therapists like myself, where they often reported experiencing moments of deep connection and engagement. And those small moments felt really important, and I realised that I'd experienced similar moments myself during my own personal therapy. And so when I went to Roehampton in 2016 and started my doctorate, we began from this core idea that the therapeutic relationship is the therapy in a way, and that it's the relationship that plays a big part in healing. And one of our tutors there talked to us about this concept of relational depth, which they defined as a dimension within the therapeutic relationship where we feel totally tuned in to the other person and experience a deep sense of togetherness. And this resonated with that experience I'd had of working with people with cancer at UCLH. And so I looked a bit into the existing research out there on cancer patients' experiences of the therapeutic relationship or relational depth. And you would think there might be quite a bit to look at, because in the literature, it's been estimated that the therapeutic relationship is probably the most important predictor of psychotherapy outcomes, other than patient factors such as their own motivation and perhaps the severity of their presenting issues. So the therapeutic relationship is acknowledged to be very important. And there's actually a lot of research out there looking at the doctor-patient alliance or the nurse-patient alliance and how this is associated with better patient quality of life. But there's very little research on people with cancer and their experiences of the therapeutic relationship. And before I did this study, there wasn't anything on cancer patients' experiences of relational depth specifically. And a lot of research to date has focused on different types of method that we might use with somebody, such as cognitive behavioural therapy, and how effective that might be, rather than looking at something more across the board, like the therapeutic relationship, that would come into play no matter what kind of method or technique you were using. So there was a little bit out there that suggested that a strong therapeutic relationship is associated with improved therapy outcome for people with cancer, but there wasn't a great deal for me to take a look at. And just to kind of talk a little bit more about this concept of relational depth, to kind of really spell out what it's about. So as I said, it's this quality or dimension within the therapeutic relationship that's been described as a state of profound contact and engagement between therapist and client. And it can refer to both specific moments of in-depth encounter within the relationship, and also a relationship in which there is an ongoing depth of connection. And just to say that this research focuses on those specific moments of in-depth encounter within the therapeutic interaction. And I thought that, as I've said, this idea of relational depth might be particularly relevant for people with cancer, because cancer diagnosis and treatment is often experienced as an isolating event and can lead to people withdrawing both physically and psychologically from others. And the research on relational depth suggests that those moments might help us to reconnect with other people and also with ourselves. And so I came up with this research question: what are cancer patients' experiences of moments of relational depth with their therapist during psychological therapy? And I don't want to dwell too much on my methodology, although I'm happy to answer questions on this to the best of my ability later on. But suffice to say, I took a critical realist position, and I chose a qualitative methodology, which makes sense given the exploratory nature of my research question. And I decided to do some semi-structured interviews because they provide an opportunity for people to talk in depth about a particular aspect of their experience. And I took a reflexive thematic analysis approach. That was the method that I used, because that offers a method for exploring patterns of meaning across participants' accounts. So that's just a little bit there on the methodology and method that I decided to use when doing this study. And now onto the research itself. So I interviewed 10 people who had experienced cancer and who had received therapy at University College Hospital. And I asked the psychologists and therapists themselves to identify suitable people, to inform them about my research and gain consent for me to contact them about it. And I had, of course, some inclusion and exclusion criteria. So I included people with all types and stages of cancer who had attended at least 5 therapy sessions from the psychological care team. People who are adults aged 18 or over, and I excluded people who were physically unwell to attend, people who were too distressed to take part, or who might be at serious risk of harm to themselves or others, all assessed by their own psychologist or counsellor. And so the results, I included 8 participants' experiences in my analysis, and 4 people who'd had a gynecological cancer, 3 who'd had a blood cancer, and 1 a bowel cancer. And I identified 5 different themes from my interviews with them when I did my analysis. And I want to spend a bit of time now looking at each of those themes in turn and looking at some of the words of the participants, what they actually said, because I think that's perhaps the most powerful and interesting part of this. And then I'll go on to have a look at some of the conclusions that I drew from that. So the first theme that I'd identified was that of being physically and psychically vulnerable. That is, before experiencing a moment of relational depth with their therapist in the therapy, participants described a strong feeling of physical and psychic vulnerability that was linked to their cancer experience. And so here are some of the quotes from what the participants said. So somebody said, "I'm not scared of many things, not scared of situations. I feel quite confident, and the diagnosis took all that away. I was feeling tidal waves of not just emotion, but actual up and down and hot and cold. And, you know, because I was obviously having some anxiety with it." And there was something about people thinking about divulging their experience to the therapist. And it was something that I was thinking, shall I say, can I say? And then obviously it poured out. And interestingly, most people made the observation that they were not always able to dive too deep within their therapy. And one described creating a barrier. It literally does feel like maybe there's a line right here and I can't lean past it that day. And then somebody spoke about not being in the right space to even think about these deeper things that were challenges in my life, because all I could think about was I feel really sick all the time and talking isn't going to help me not feel sick all the time. And so moving on to my second theme. The second theme is being rescued from the waves. And during a moment of relational depth, people described a shift from experiencing these tidal waves of difficult emotions to finding a much needed port in a storm. And one of the sub-themes here was being held in the therapist's mind and also within the therapeutic space. And so one participant said she didn't have her phone out, she didn't have a recording device, she remembered everything, and it was like 2 friends sitting and talking. And again, it was that real connection level. You know, sometimes the doctors are so busy and they'll say one thing to you one week and you may get a slightly different answer the next week. I never had that. It was always the same. She remembered everything. And then someone else said, it's almost like a visceral, like she's so in the moment with me that she feels a bit of the pain that I'm feeling in that moment, just for that moment. And in that moment, she recognizes and she registers the way that I'm feeling, and it connects with her. And another sub-theme from this second big theme of being rescued from the waves was being taken care of. And three of the key words around that was feeling a sense of validation and kindness and compassion from their therapist. And so someone said it was just a really empathic kind of, me going, I'm really sorry I'm going here with this. And she was really like, no, who wouldn't? That kind of like, this is very human and this is okay. And then I was in a really vulnerable situation, and then to spot that human element, or, the kindness of it as well. And the fact that we connected at that point, it just felt warm. I felt safe. And moving on to my third theme, which is experiencing the calm after the storm. So there was this sense, or I kind of thought that I found this sense that following a moment of relational depth, there was a kind of calm, and there was some time and space to reflect. And so there's that calm when you're still on the water, you're still feeling it, but nothing's coming at you. Emotionally, you've got this thing out that you didn't even know needed to come out, and the way it came out, and now you can kind of sit with it and float with it. And most people also describe the way in which a moment of relational depth resulted in a new sense of direction for them. So you can get that validation bit with direction. And I don't mean direction like, now we're going to do this and change the way you feel, but not leaving you mired in this deep emotion, but like, okay, how can we put this back together to, move forward? And the fourth theme is more than a feeling. So the actual impact, the relational impact of these moments of relational depth. So here I'm describing the impact on how participants related to both themselves and also to others after having these moments of deep connection and engagement in their therapy. So to look at the impact on internal relating, one person said that kind of contact would stay for quite a few days. It really was changing the quality of my life in a way that was really helpful. There were really moments when I would tip into my feelings and my cognitive side for once would just be quiet. And then, as I say, there was also something on the impact on relating to others. And somebody else said it gave me permission to be more open about how I was feeling about all that with the people in my life. So going back and being able to say, you know what, I am feeling a lot. And then there's one final theme, which is an overarching one that describes who the therapist felt like in relation to the people, that they had this sense of the therapist as both a stranger and not a stranger. So participants talked about their therapist as being all kinds, I guess, of different people or representing different things to them. So they talked about their therapist as a professional. I know we're part of her job and we're her patients, clients, whatever. And then the sense, because it didn't happen to them, they were able to kind of pull you out of the water. And people also describe this human connection, which perhaps connects back to that theme around the validation and the kindness that they experienced. So as soon as I saw her, she cried. And instantly I felt there was a connection, because it wasn't a clinical robotic response. There was an emotional human connection, and I'll never forget that. And for some people, they saw their therapist sometimes as almost a savior. So one participant said, she's the only person I know that can really help me through this. She's so desperately important to my recovery and my well-being. I really believe that the last thing is to be in this headspace on my own. So having the security of knowing that she's there. Linked to that, participants also talked about their knowledge that the therapeutic relationship had limits and that it would end at some point. And as such, these moments of relational depth, these moments of deep connection and engagement within the therapy could also be experienced as bittersweet, especially if people didn't feel they experienced those moments elsewhere in their lives at the moment. And so somebody said, I keep thinking, well, she's not giving up on me. She knows what's going on with me. And that was a worry as well. It might be that something happens. She might leave. She might not be my counsellor. I think I would find that so hard. So I've included the thematic map that shows all of my different themes and the sub-themes and how those kind of come together. I've just included it there just for a bit of an overview. So that being physically and psychically vulnerable, perhaps before a moment of relational depth, and then that sense of being rescued from the waves during relational depth, and then experiencing the calm after the storm. And then the idea that it was something that kind of lasted beyond that particular therapeutic interaction, that it did have an impact on how they related to themselves and to other people. And then how they saw their therapist, knowing that they're a professional, but also really feeling that human connection. And for some people, feeling that they perhaps put their therapist on a bit of a pedestal and saw them as a saviour. And then that kind of real, I guess, worry for some people around the relationship ending. So I just wanted to move on and look at some conclusions on my results, and also what some of the implications might be, I thought, for clinical practice. So what conclusions did I come to? In common with existing research on relational depth, this study found that during these moments of in-depth encounter, participants felt understood, accepted, and cared for, and that this resulted in them connecting with themselves and others in a more nuanced and ultimately more positive way. What I thought might be unique to this research was the participants' often acute sense of vulnerability and fragility, both prior and during these moments of relational depth, and the common positioning of the therapist as a protector or saviour, and also this high level of anxiety that some people experience about not being able to be with their therapist, if they perhaps had to wait quite a while to see them again, or the knowledge that that therapeutic relationship would draw to a close at some point. So I wanted to conclude and then perhaps get into some questions and comments, but with some implications for clinical practice, and I guess for practice for all of us. And when I was doing my analysis and putting together my themes, I read this article by Professor Fonagy, who is the head of psychology at UCL. And I guess this headline kind of quite almost sums up my research. I mean, I think perhaps first and foremost, my study reiterates the central importance of our kindness, care, and human approach, both within moments of relational depth and within a therapeutic relationship more broadly. And within a cancer centre setting, I argue that this is particularly poignant, as during the process of treatment, there is the potential to feel dehumanised or reduce the part of us that has cancer. And as this article said, kindness is more than sentiment. Real kindness also entails some kind of empathy. So it requires us to understand how the other person came to think and feel the way they do, no matter how difficult or unfamiliar that might seem to us. What might that mean? What might this mean for clinical practice as a counsellor or psychologist, or more widely within the cancer care setting? I think there might be something about making sure that we're not under-involved with the people that we work with, as well as, the possibility of being over-involved. But perhaps we can communicate to somebody what we might be learning from them, or the personal impact that they might be having on us. So the next thing, I guess, while it might be important that we have this warm, open and human approach, people also did state that they saw their therapist as being the person who was holding the safety rope and could prevent them from being swept out to sea. And as such, I think it might be important that a balance is found between encountering the other person as a fellow human and also being a steady ship who can help to weather their storms and remain afloat. So perhaps there's something around being authentic and in touch with our own processes, but also being consistent and reliable and willing to share our knowledge and ideas about how the person we're working with might proceed. So, being able to bring in and acknowledge our own skills and expertise as well from our position as a professional. And then the final thing that I wanted to come back to is that I think it's important to hold in mind that people with cancer might be experiencing intense physical and psychic vulnerability, and working at relational depth can be helpful, as it might help somebody to unveil some of their painful emotions related to their cancer experience, and that idea of feeling sheltered from the storm or getting into a port from the storm. But I think we should also be mindful that for some people, it might be the only space in which they can currently experience this level of connection. And that while such moments are experienced as very precious and powerful, they might also lead to increased anxiety about the future unavailability of the therapist or the end of therapy. And so in order to manage this and to bear this in mind, I think we should give careful thought on how to approach gaps and endings in our work if we're working as a counsellor or a psychologist in this setting, and consider whether the door could remain open for somebody to re-enter the relationship at some point if this is very much needed. I guess there's also the possibility of therapeutic letter writing at the end of therapy. So writing to somebody and reflecting on that time spent together and giving the other person the option to write back with their reflections, so that I guess it feels like a kind of complete and satisfactory ending to the work together. So that was the presentation, which I rattled through quite quickly. And so just over for any questions or observations at this point, or anything I can go back over that perhaps needs a bit more attention.
That's great, Ruth, and thank you so much for such a thought-provoking presentation. Guys, is it possible for you to just take down Ruth's presentation, or Ruth, stop sharing?
Cool.
Yeah, and lovely, and then we can spotlight you and people can ask questions. So we've not got any questions in the chat just yet, but in my experience, sometimes it takes people a while just to kind of get going with the questions, really, and there's a lot to absorb from your talk. But I guess one of the things that maybe I'll kick off, I was thinking about one of the many things I was thinking about was around, I guess, the last 15, 16 months has been, very difficult for therapists and staff, everyone. We've all had a difficult time. But I suppose I was just thinking about the impact of burnout on, those relational relational depth and developing those moments of relational depth. Have you had sort of any thoughts around, the impact of that on people's kind of therapeutic outcomes, really?
I guess I have thought about that a bit. I guess that there is something about the idea of burnout or perhaps overload in terms of hearing about people's experiences. I guess there's also the fact that many of us have been working in different settings. So rather than seeing somebody face to face, we might be seeing somebody remotely via video or on the telephone. And I guess that might also have implications. I think from my own experience, it's still possible to have those moments. So perhaps that kind of experience overcame one of my preconceptions about working in a different way. But it's certainly a different way of working.
Thanks, Ruth. So can I just open up the questions to participants on the call? Do we have any questions that people may not want to put in the chat, but just to unmute and ask Ruth directly? If you just want to put your hand up, then I can, or just call out, I can find you. And I suppose, Ruth, I guess where this takes us going forward in terms of, if you don't have if you can't create, I guess, this relational depth with your clients or your patients, where does that leave us in terms of sort of predicting therapeutic outcome? I mean, you talked about it being the most important predictor of therapeutic outcome. And I don't know, do you think you have to always create moments of relational depth or that connection in order to have therapeutic outcome?
No, I don't think that. I think it's the therapeutic relationship more broadly is considered to be the most important predictor of therapeutic outcome, but that's after other factors to do with the person themselves in therapy, so their motivation and what exactly is going on for them. But the therapeutic relationship is considered as a result of research to be more important than the particular technique or method that you might use with somebody. So whether you decide to go down a CBT route, for example, or a more humanistic route. But I certainly wouldn't say that relational depth is for everyone. And I think that's the conclusion of my research tutor who wrote a book about relational depth. That absolutely it's not for everyone. Some people don't want to have that kind of connection perhaps in therapy. Perhaps for them they do want to have something maybe more solution focused, more focused in on goals, or that's not necessary for them. So it's certainly not a prerequisite at all. I guess it's thinking about how, though, it might be particularly powerful, particularly in relation to people who are experiencing cancer.
And I think, Gulshan, you've got a question for Ruth. Do you want to get going?
Hi there. Hi, Ruth.
Hiya.
Thank you. That was very, very, very thought-provoking. It was very interesting research. I just had a quick question about endings and thinking about the therapeutic relationship. And when you were mentioning therapeutic letters, it made me think a bit about how in the CAT approach, I think they often write letters. And I was just wondering if you were using letters in your current practice with patients at the moment and how it's going with cancer patients as well.
Yeah, I sometimes use letters with people. I guess, so I might do that if I feel that there has been these moments of deep connection, or that the person I'm working with might be experiencing some difficulty or distress in relation to the ending. So I remember somebody I worked with, it was one of the people I worked with who had a cancer diagnosis, and they were clearly very upset about ending, and it brought up a lot of memories and associations for them. And so I did write a letter, and I did make sure that I allowed a bit of time for her to read it and then to talk about it in the therapy and sort of respond to it. And then, I mean, she had the option of writing back, or I think she just said to me within the session itself about the letter. And I think she found the letter quite helpful, and I guess it was an object that she could take with her, and it was somewhere where I could express, I guess, also what I'd learnt from her during the work, what I felt, we'd focused on, what might have been important, and just something about saying goodbye, I guess, as well. So yeah, I have used it several times.
Thank you, Ruth.
Any other questions for Ruth? Jenny, I was going to put you on the spot, if that's okay. It's just that I know if we looked at the sample size, a lot of them were gynae patients, and I suppose I was just, I don't know really, I kind of wondered whether you had any reflections on that, or maybe it was, I don't know, Ruth, why did we have a lot of gynae patients? I don't know.
Yes, I own up to half the sample. I was really touched, actually, it's quite a strange experience, and I don't know which of those quotations were my patients, of course, but knowing that patients were talking to Ruth in detail about the therapy was quite a strange experience, but also quite moving that so many people were keen to come forward and volunteer, which I think in itself suggested that it had been a meaningful experience and they were happy to talk about it. People that I suggested and put forward were all people who had had a relatively long treatment with me, and were particularly articulate in describing their experience, which I suppose is my question for Ruth, is how might you have gone about your research with people who didn't have the ability to talk in such, I mean, they were particularly sort of articulate quotes that you chose. And I'm not saying that the whole interviews have been, quite like that, but they were all very highly thoughtful, educated, probably from a bit similar socio-demographic. And I wondered whether you would have any ideas about what research might have looked like with maybe a wider sort of group of people who might not have been able to provide such eloquent accounts.
Yeah, well, so I did use convenience sampling. So it was, the people who came along who fitted the relevant criteria. And I guess in terms of the people that we might see, that might also be skewed in terms of the socio-demographic background and also gender. Most of the people I spoke to were women. There was one man there. Interestingly, the man was perhaps the most, I guess, emotional and sort of touched by his experience with his therapist. Yeah, I mean, I guess it could have been different. And of course, it's important to say that two people that I interviewed, I didn't end up including in the analysis because they weren't able to speak to an experience that I thought was about relational depth. And it wasn't quite clear to me whether that was because they just hadn't experienced it within the therapy, which could of course be the case, or whether they couldn't quite recall it, because it can be quite difficult to go back and to really talk around it. And the people that did talk about it, I had to sort of, I guess, set the scene a bit and try and get them to you know, sort of imagine a particular thing they might have been talking about and such like. So it could be that people find it, because I guess it's quite a sort of tenuous thing. It's quite something that's quite hard to put your finger on. And that's part of its sort of intangible quality. But yeah, I was struck by I guess also how many people were able to talk about it, and were able to talk about it in quite a powerful way. And also just to say, what came across is how much they appreciated and really loved and cared for their therapist. So, you know, it was obviously a very meaningful relationship for them, perhaps one of the most meaningful relationships that they were currently having. And they would often talk to their family and friends about their therapist and about seeing them. And so it was almost like the therapist had become another member of the family in a way during that period of therapy. So I think that's quite interesting to reflect on as a therapist, how we feel towards our people we work with, but of course how they feel towards us. And that can be kind of quite powerful, how they feel towards us.
No, that's really interesting. And Jenny, I don't know whether you wanted to come back on that at all. You don't have to.
No, I don't think so. I'm exhausted as well, and no, I think that's a very fair answer, and it would be a very interesting and very different sort of piece of work, thinking about relational depth with people who might not be able to express it quite as easily or verbally, and how one might think about it, but it would be a different piece of work.
And I guess that's, yes, it's the limitations, isn't it, of a study at times when you have a small sample. We have so there's a question here from Paula around what other types of ending therapeutic relationships suggestions are there, which is quite an interesting question. Ruth, did you, or anyone else really?
Yeah, there's quite a few other therapists on this call as well. So if other people want to chip in on that, I guess it's about bearing in mind that for some people, drawing the therapy to a close perhaps won't seem to be that big a thing. But for other people, it will be very significant. So how might we bring the encounter to an end, knowing that it's going to have to end, but doing it in a way that somehow feels satisfactory? So I guess it can be quite important to work towards an ending. So if somebody's particularly anxious about it, to, I guess, have a date in mind, and then during the sessions to talk about it and to talk about, you know, what the person is going to draw on, I guess, you know, what they've kind of might have developed as a result of the sessions. And then I suggested the letters as well as a way of working towards an ending. I don't know if anyone has any other suggestions or ways that they've approached endings, or...
I am at the beginning of my training as a psychotherapist, we were encouraged to think about each session as the first and the last session, because we were never really sure the person will come back. So to an extent, especially with cancer patients, and for me, cancer patients that I saw in the hospital when they were unwell and I didn't really know, I did have that in mind, that I wanted to make sure if that was our last session, then that everything had been explored, or that I have facilitated as much as it will be possible that particular session. But I have used therapeutic letters when patients stop coming and they don't necessarily have said that they want to stop, and there's not been time to work towards an ending.
Oh, thank you, Maria. That's really interesting. I mean, and And just out of interest, just because I'm not a psychologist or a counsellor, I mean, what do you put in a therapeutic ending letter? What would one write, broadly speaking?
I mean, I guess you might put all kinds of things. It would depend on your relationship with that particular person and what you'd worked on together, and what you think it might be helpful for them to hear. Golsham referred to a particular type of therapy, cognitive analytic therapy, and there might be a specific format to writing a cognitive analytic therapy therapeutic letter. I'm not very familiar with that particular model. I guess I would often use the letter as a kind of reflection on our time together and some of the important themes and areas that we might have covered. Things that have struck me in particular, I thought might have struck them in particular. I might want to kind of comment on some of their strengths and resources that might be worth bearing in mind for them as they move forward. And as I said, something about, learning from them and what I've gained from being with them. So there's one person I have in mind, taught me a great deal about what it was like to live with a particular disability. And I guess I felt it was important to share with her that I felt that she'd also been a kind of, a teacher. And she found that, I guess, quite moving. And for her, that was, I don't know, it was something that she welcomed, hearing that. I don't know if anyone else can think of other things they've included in their letters that...
Anybody want to make a comment on that? No? Oh, that's fine. Not to worry. Oh, Maria, you have a comment.
I think there have been times when I have included things that I think might be helpful for them to access if they don't necessarily want to continue having therapy.
That's a really valid point, actually, Maria. Thank you for raising that. So before we start sort of concluding this session, are there any other questions that anybody wanted to ask, either in relation to the methodology or the experience of Ruth's PhD work? No? I guess we'll probably start to just conclude now, Ruth. And I guess I just really wanted to thank you so much for joining us for our second forum in our Supporting Cancer Care Research Forum, which is our new venture. And I think your study has been so interesting. And I think we've all been with you, some of us have been with you on this journey. And it's just so wonderful that you've come through the experience of the PhD very successfully. Once again, thank you for taking the time to sort of disseminate your findings to us. And it's been really thought-provoking, actually. And I think it's one of those things that you mull over a lot after you've heard it. So thank you very much for presenting. This will be recorded, so you'll have the opportunity to have a look at yourself online on YouTube. No doubt that will be delightful.
I'm sure I'll be doing that soon.
So thank you so much, Ruth. And Guy, do you want to just flip up the final slide, and then we can just talk through our next forum. If you'd like to be added to our circulation list, I think most of you are on it. Please contact me. We really would like your feedback. We will send you this link via Eventbrite as well. And so it'll come through your email system. And then in about a week or so, we'll send you a certificate of attendance, and that you can use that for any revalidation, etc. Our next session is on the 27th of July, and we've got Dr. Rogani Govender, who's our consultant speech and language therapist. He's going to talk about using behavioral science to optimize prehabilitation interventions. And she's going to use head and neck cancer patients as an example of that. We'll send out the Eventbrite link to our sort of regular circulation lists. And I guess finally, I just really want to thank you all for attending and for your attention. You know, you are what makes this research forum successful. So please continue to keep joining us. Our talks will be very varied around research. So without further ado, just to say another massive thank you to Ruth and to you all for attending. So hopefully see you all on the 27th of July. Thanks everyone. Thanks Ruth.
Thank you. Thanks.
Take care.
Bye-bye.
Bye-bye.